Okay, then I guess we approve the previous minutes, right? Is that something we do?
Yes.
Okay, do I have a first motion? Second, okay, and a vote? Ayes?
Aye.
Okay, the ayes have it. Those minutes have been approved. Okay, so anyway, we have somewhat a full day today, but we have to start off with the annual elections of the board members. We look for a president and a vice president. I've been the president I gotta put in this position in like short time. I don't want to be that person who hogs the president. I enjoy this, but if someone has a burning desire to do it, I will gladly step back because I don't want to be that person who takes it. So if.
I'd like to nominate Sal for president.
I second that nomination.
We got a vote.
Have a vote?
Votes for Sal?
Aye.
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 And nays? No? Okay, looks like Sal's the president. Thank you, guys. I appreciate that. All right, so that takes care of that. Vice president? Anyone?
Karen has been serving.
Yes, I would nominate him.
Okay, second. Okay, votes for Karen.
Aye.
Aye, yep. And the nays? Okay, the ayes have it. The board finds Karen will be the vice president for the 2026 Fisher Health Department. Excellent. All right. So we got rid of A. B, new ordinance policy review.
So I'll start this. This is just our 2026. I've kind of framed it as priorities and then specific goals. So these priorities are kind of like overarching. These are not substantially different than what we've talked about in previous years, but since we're at the beginning of the year, we thought we'd just start with that. With the decrease in funding from Health First Indiana, our main goal is just to meet the funding requirements. We continue to kind of expand our options for being more sustainable, and that means revenue, right? Whatever that kind of looks like. Expanding our community partnerships, aligning with community and resident needs with a high degree of intentionality. We do intend to apply for accreditation this year or apply for readiness to accreditation. Josh can use the specific wording that we need. We are continuing to work on expanding our clinical services, and Jen will go through what the next things on the list are. Continue to refine some of our services from the social work program integrated with public safety, and we'll talk a little bit more about specifics here in a sec. Continue to offer all the community basic education that we have, and we're expanding those services continually. We've added a whole bunch of new classes over the last couple months that we're happy to talk about. And then continue our strong partnership with the schools and with the school health program. So doing a lot of everything in every direction all at once, pretty much. And then we have some sort of more specific actions or goals for this year, which include implementing a permitting and inspection program for massage parlors, possibly some definition that would include spa services, tattoos, eyelashes, potentially nail salons. So we're going to talk about that with you guys today. Establish capability to support improving children's mental health. We're going to talk about that a little bit today. Expanding clinical supports, which includes clinical services for chronic disease screening and prevention. Coordinating and facilitating offerings for peer and community support groups. We're not sure exactly what that'll look like yet. We're still in January. So expanding community-based follow-up for frequent EMS utilizers. So we've been doing mental health supports. We're going to expand into chronic disease, kind of frequent flyer medical supports over the course of the year. And then increase the reach of all of our programs by 10% is a specific goal that we have. Applying for accreditation, as I mentioned before, we're looking to design some new non-tax funding mechanisms or vehicles to support expansion into the programs. And then ideally create a resident advisory board, which will also kind of meet some VAB criteria as well. similar to what hospitals have in the patient advisory capacity of PPACs that hospitals have. Any questions about any of those?
You're gonna go into in-depth on.
On a
most
couple
of them.
things, a couple things,
Couple
yeah.
of things. Okay,
A couple of things. We're not ready to go into in-depth on all of them. We haven't achieved all of our 2026 goals yet here at the end of January. But we're working hard to move them all forward. So. Specifically for the new ordinance, I know Lindsay's been looking at some other models as we look to kind of find a way to inspect things such as massage parlors. We've talked previously about tattoos and eyelash extensions, but we haven't implemented it yet. But I know we had the board support for that a while ago. Potentially nail salons. Just looking to start conducting sanitary inspections. Just for background for you guys, tattoos and eyelash extensions are common. There's state code that outlines what that is. A lot of jurisdictions have ordinance in place for those inspections. Massage parlors and nail salons are uncommon. There is no like state code for that. There are a few examples. So for example, we have a draft of the massage parlor ordinance. There's another county in the state that has that as an inspection program. So, you know, we're looking at that as sort of a draft version, and we'll work through to get that introduced to council. The goals are for public health and safety. So by going into these facilities, we're really monitoring partly the sanitation practices of some of these facilities, and partly just making sure that we're safe from a public safety perspective, that there's nothing else happening in a facility that could be of concern to the public safety. So just sort of wanting to get your input on that as we figure out how to do this. I think from a legal perspective, it looks like we may need separate permits for each service. So it's not like a restaurant where you have one type of service in one facility, right? There's so much overlap in all of these services, like a hair salon can do nails, or a spa could do microblading, which would be under the tattoo rule, or a salon loft person could do eyelashes, right? So there's so much overlap in who's providing these services. We have to figure out what are the commonalities. So I think what we're talking about is each type of service would be a separate permit due to that overlap from my understanding. The inspection would be a sanitary inspection. So we're just looking at sanitary practices. You know, tattoos are a little bit more involved than most other things. Most of the things we're just looking at what is their cleaning protocol, what is their hand washing protocol, do they have access to appropriate equipment to sterilize or sanitize, et cetera. And then, you know, put some specific standards in place. I think for example, massage parlors, I think, give a good example of the types of additional requirements we could put in place, like no red lighting, or no, you know, you have to have white or yellow light bulbs at a certain wattage, just for transparency and above board, making sure that we're keeping the kind of facilities in Fishers that we want to have in Fishers. So I think the ordinance would have some of those requirements in addition to the sanitary requirements. Is that accurate, Lindsay? Yeah. So just some questions for consideration. And again, you guys aren't the final deciders when it comes to fees and things like that. But suggestions from the board would be appreciated. I know we're not looking to recoup the cost of this service right now. So trying to match, like we've talked about with the restaurants, trying to match the cost of the inspection program with the cost of the permit. That's not really the main goal here. So, you know, and then with the different facilities needing to get a different permit for each type of service that we're offering, for each type of service, I think the question is, does the board have any recommendation for what would be an appropriate permit fee for us to propose to council, given those kind of considerations? Are we talking about like a $20 permit fee to provide that service, a $100 permit fee to provide that service? Again, and would it be per provider of that service or per facility that offers that service?
Can you have a permit fee and inspection fees?
I mean, you could, sure.
Because it seems like $20 for a permit, and then you've got to go back there 2, 3, 4 times. It seems like a bargain, and you have to pay your employees, and it takes time and materials, so I don't know if that'd be more practical.
Maybe, or we can do like like what we did with the restaurant fees was, we have the permit fee, which includes the standard frequency of inspection, which is like, and that's another question here, like, is there a feeling from the board of what the inspection frequency should be for these types of facilities? We don't have a baseline to compare it to because we haven't been inspecting these. Is this an annual inspection? Would that be sufficient? In which case, like the permit fee, does that encompass that first inspection or that annual
Is there a lot of
inspection
turnover?
frequency?
Is there a lot of turnover in these types of places?
From a person standpoint,
Yeah, from an employee
from an
standpoint.
employee,
I
I
mean, that
don't
would-
know what the turnover rate is, right? Like
Right.
my inclination would be to recommend that we permit it by facility, but because we're inspecting the facility, but some of these facilities, like when we're talking about salon lofts, the facility itself isn't the keeper. It's like they're all private businesses, right?
The only reason I ask,
Here, from a permitting.
the only reason I ask is nursing homes have a large turnover, so I didn't know if that was.
I have no idea what the turnover rate is for these types of facilities.
I can tell you that when it comes to speak for physicians, I'm not gonna speak for the vets and the pharmacists. We pretty much suck at business deals. and shit. So when you throw out like, hey, come up with a fee, so I would propose, I think so. What you're saying is there's tattoo parlors, there's nail salons, there's massage parlors.
Yeah.
And then there's like eyelash extension.
Yeah,
Okay. And they all each fall under a separate category. So we would have to kind of come up with each separate one.
yeah, I think when Lindsay's been looking at the kind of how this might work, that's,
Yeah, I think that's probably the easiest, just
And you
because
hear
you
it based
have
on like.
a hybrid of several different types. So there's not a way to have like one fee for nails and hair.
Yeah.
And then one fee for nails, hair and eyelashes. It's just, I think it's a lot cleaner if you have one permit per service, and then you might have 5 services.
Yeah, no, I totally agree. Cause like, I'm picturing one of these nail salon places where it's huge and there's like so many different people in there. How you gonna, they're gonna come up with different names and they're, oh yeah, we only have 5 employees here, if you start charging like that. So I think I agree with you per facility, a permit and then an inspection report. And then, because I think most of these places, we're just looking to make sure that they're cleaning, the massage place are cleaning the, what do you call that thing that they lay down on, the cot? Or we want to make the table, the massage table, we want to make sure that they're being cleaned. If they're using towels, we want to make sure that they're.
Sanitation.
So, right,
for business.
Yeah, because if you do per facility, there's a lot of individual chairs that people rent out. They have their own license.
so what are you saying?
And that's kind of what I was running into as I was drafting. Initially, I thought, well, per facility makes a lot more sense if that's what we're trying to do. But then as I'm kind of getting into the meat of it, it's like, well, there is
Not
definitely a reason to have like per provider.
Yeah.
For that reason too.
Yeah, you do see a lot
To
of.
go per business.
As opposed to facility?
And facility. So have like one for the facility, but then have each provider or business,
Business, yeah.
have their
Could you
own.
do that at a place like Salon Lofts where they're just renting their
Stalls.
tiny space?
Yeah, so that would be like their one space would be their business, the one person that has.
Are there
That's the-
licensing certifications for these
Yes.
services?
Yes, I was gonna ask that.
Yeah,
Each have to have their own license for.
right, so is it
Already.
more
They should have them posted anyway, so.
Right. Is it more practical to inspect the stall and the person than the building? I don't. I mean, I'm not an expert. I trust your recommendation, I guess is what I'm saying. If you have any, I mean,
Manpower, does that take you to do that?
yeah,
Time.
I mean, would your recommendation be to do per licensed provider or certified provider or just the building in general?
Um, I think this is super sticky and again, we'll keep looking into it. I guess I'm just sort of looking for some general input from the board, on if you have any general insight on that. I don't expect you to be experts on
Yeah.
how Lawn Lofts operates, but these are kind of some of the sticky issues we've come into as, just trying to figure out how to go about this and write this because it's so different from a pool or a restaurant or a septic tank.
Question for Lindsay, from an accountability perspective and a liability perspective, is it the provider or the person that owns the building?
So I think you would want both. Like,
Okay.
I think you want somebody accountable for making sure that the facility has a washing machine, a dryer,
Right.
every,
The general stuff,
yeah. But then as I'm looking at the application and permit for like the individual provider, they're gonna have to provide that they have a license, that they
Right.
have, graduated, that they basically are qualified to offer that service.
Should you hold the owner of the business accountable for that?
So the owner of the business, in my mind, would be accountable for kind of the sanitation part and
Facility?
making sure that they hire people who are permitted to
Okay.
be there. And then you would have an individual provider who's also accountable for following the sanitation rules. Maybe they're not responsible for making sure there's a working washing machine.
Right.
They are responsible for making sure all the linens that they have.
So would there be an operations or policy procedure manual that the owner would maintain and that you look at?
Yeah, it could be. I mean, the requirements are not,
Really lame.
yeah,
Sorry.
well, they're not extensive. I mean, it is as simple as like, if you have a soiled linen, if you have blood on the linen, this is what you do with it. If you, you need to wash for 25 minutes at this degree, like they're kind of in depth, but they're not extensive, if that makes sense. So I think the question is, do we want to have just the facility at this point say, hey, you need to provide these things and you need to make sure that these things are done? Or do we want to get more in the weeds with pro providers and say, you need to come in and get a permit so that you can do massages within the city, within a permitted facility. And you will also be held accountable for following these rules. And if we come in and we see a big bag of bloody linens in your stall or your
Uh-huh.
room,
What do you think?
your
would be-
permit will be
Yeah. What
revoked.
do you think would be best practice? Both?
I think both.
Okay.
But again, I don't know.
If it's rec.
Manpower, you
Yeah.
get better
Is
quality.
there any distinction between, for instance, a small business owner that owns the building and the staff versus the places that there's a landlord and they rent space? Is there a
Mhm.
distinction for that? Because it seems like in the smaller ones where they're renting space, they're the business, so they should pay and the building should have, as you were saying, but if you go to a small business owner, I mean, yes, they have to have licensed people, but in my mind, they would be responsible for everything versus that individual person being like a business compared to the other scenario. Does that make sense at all?
So
The analog, this exists right now, and I'm not using anyone's name, so you drive down the street and you see like Duke Realty owns a medical office practice, and there's 12 different office, and they're each individually licensed practitioners, Dr. So-and-so, Dr. So-and-so, Dr. So-and-so. Each of those individuals is licensed and they run their office practice in there, but there's nothing, legally binding and says that, Duke Realty is medically providing any kind of service.
So Duke would not be the permit holder, the
Correct.
individual.
And so that would be Salon Lofts in this case would become the landlord or the property holder.
Yeah.
And so just kind of thinking about it in that sense.
Yeah,
Yeah,
Yeah.
so yeah, whoever owns the building, unless they also own the business,
right.
that wouldn't be the permittee. The person who owns the business would be the permittee. And they would be responsible for making sure their build out complies with, however many washing machines they have, however many, linens they need to buy to supply the massage therapist, things like that. But yeah, if Duke Realty owned the building, they would not be the permittee.
There's the crux becomes because a business can have employees and then they're responsible for the employees. But a business can have contractors
Yeah.
and they're basically saying, look, they just come in here and that's it. So you'd have to be able to tweak that.
Yeah, and I think whenever we start looking at individual providers, that helps that as well, because there's really no distinction in the permit world. Of course, there's other distinctions, but in the permit world that we're in, it wouldn't matter if they're an employee or an independent contractor, because they would need to have a city of Fishers permit to be able to do massages regardless of their employment
Well,
status.
I'm saying that you can have a permit that is the umbrella of the facility.
Yes,
And then have that other part, the second part, which would be if they're non-employees, then individually. Because if you do an inspection, if there's 30 stations, I mean, if they're all employees, then you're assuming that all 30 stations are falling under the umbrella of the employer and everyone is cleaning and everyone's doing everything the same way. But if you have 30 separate stations that are all contractors and they're on their separate business, you can inspect 2 or 3 or 5 or whatever, but you don't know what the other people are doing. So you would have to, I would assume you'd have to inspect every single one. Does that
Yeah.
make sense?
Treat them as an individual.
So
business.
Yeah, they're individual businesses, like, I don't know how.
yeah, I don't think you can get away.
This
from
is why it's sticky, right?
Yeah,
Like-
yeah.
And that's why I say that you, if it's an individual business within a building, then you have to inspect each individual business.
I think the other challenge, and just to consider, is that these businesses also have practitioners that do in-home care, right? And so you can do nails, or you can do cutting hair, or you cosmetology can be something where I don't need a physical facility, I can come to you.
Yeah.
And so there's that potential that these, it's one of those, making sure that, again, the ordinance is, what we're doing is a sanitary inspection, so it actually is about the physical facility where you're conducting the business, because I'm already licensed to be able to provide this, service or whatever in your home or wherever you want to do this. We're just talking about guaranteeing the physical location that, yes, this is a sanitary place to conduct this type of business.
Yeah, I don't foresee it as doing any kind of inspection of it in home. I don't even think those are probably allowed per zoning. I would have to. Okay. But, yeah, I think this is focused mainly on your business that you see in a commercial building.
So you wanted a recommendation for a fee structure? Is that?
Yeah, I mean, and I think you guys have given a lot of good input
Yeah.
into how we can think through this.
Yes.
That's helpful. I don't know that you need to vote on it, but you can if you want.
I have a question. If we, the restaurants, obviously their businesses, they make revenue. These will make revenue, and I know the services are not inexpensive. Please remind me, what's the restaurant fees again?
Well, they're on a tier, so it depends on the risk level of the
Okay.
facility, and we didn't take them up to the sustainable level. So it's a good reminder to me that, we need to give you kind of an update on the last discussion that we
Right.
had in October about the restaurant fees, where you made a tentative recommendation to take it so that the program would be sustainable. Instead, we took it to an increase of approximately 30%. So it wasn't the full like 50% or 100% increase that we were talking about to be a sustainable program. So we've raised them on average, but by 30%. We still have the fee, the tiers like we did before, but it's not quite the shocker that I think what we talked about it having potentially been to be a 100% sustainable program.
And the reason I ask is because if you look at the services provided and the cost of them, $20 seems really low, but to me, but I don't know what's palatable.
What's the lowest tier on the restaurant?
200 for a level 1.
You have to remember the services they provide, there's so many, so per service, for nails, for eyelashes, there's multiple they'll have to pay for. Most of these places do multiple services. I mean, 20 sounds low, but
Or is it 50 or 100?
Yeah,
I mean,
or-
I would take any suggestions, especially as we're talking about these these two types of permits, right? You've got an individual based permit and then you've got this facility permit, right?
Yeah.
So
Yeah, your
Is there a
facility
class?
permit could certainly be
Your-
much
your facility permit could be larger and then you have these individual permits.
Is there a classification that this is called, like providing everything that you described, massage, eyelashes? Like, is there a classification like,
Personal.
And that's
care
a teach-
services?
pardon?
Personal care services?
Yeah, something, I didn't know if there was some,
But there's no single thing, which is why this is so sticky, because there's no single certification, right? Because cosmetologist is a licensed provider, esthetician is different, nail tech is different than an eyelash, somebody that gets a special eyelash certification from the state if they're not an esthetician, and then, there's a lot of facilities that have like one of these services, but not all of these services, and they're all over the place, right?
but for simplification purposes for us and the user, Josh makes sense. Do you classify it as, what did you say?
Personal
Personal
care.
care services.
Yeah, do you create semantically something that they fall under just to make it simpler for the people that have to purchase the permits and stuff like that? That's just a suggestion. Instead of piecemealing it, okay, if you're an eye person, if you're microblading, if you're cosmetologist, if you're a massage, I don't know.
Yeah, the only reason why I was thinking about that is there are different standards for each, and
Right.
each has its own license with the state.
Mhm.
So I think that's just how my mind works too. It's like
Right.
very,
Yeah.
how can we make
It's
it?
siloed, right?
Yeah, but if that is the direction that the board would prefer to go, we could certainly.
Yeah,
figure
I
that out.
just don't know. I think it's a good idea, not being a subject matter expert, but what's the pros and cons in your eyes, I guess, to doing something like that? Do you think it's not practical? Or
Yeah, for me, just for the enforcement piece of it, it seems like it would be a lot easier for me to, say, you don't have a license to do, you're not a manicurist licensed by the
Right.
state. So therefore you don't qualify for a permit, or you have the license by the state, you have the permit, but you're not following the sanitary standards that a manicurist should be following. But you also do eyelashes. Okay, well, do you have your license or permit for that? Oh, you are following the standards for that. So we'll just focus on the manicurist. For me, it just, if I'm taking that to a judge, I feel like it's a lot
Yeah.
easier for him
Right.
to grasp. There's a license connected to this service. There's a permit connected to this service. There's standards,
It makes sense.
and
Yeah.
they did not follow those standards.
I think that sounds more clean and clear. when you
Yep.
Describe it that way.
I would just say, from a cost standpoint, just take like numerator, all the services you're gonna, so 100 nail salons, 10 net tattoo parlors, 100, take that, divide by the amount of time you spend in each place, multiply by your hourly rate, and find out what it's gonna cost, because I would hate for this to take money away from a lot of the other things you're doing as a health department. So I would hate for this to be because again, it's something we're adding, I would hate for this to take away from something that we're already doing really well at. So that my only advice would be just make sure that it's not something that, doesn't need to be, you don't want to pass laws just to make, it's not about a profit center, just don't lose money here because we need it so desperately everywhere else. So that would just be my sincere hope, is that this doesn't end up detracting from the good work you're doing everywhere else.
My recommendation would be $50 for a permit and then $25 or something like that for an inspection. And that's per inspection. Because if a nail salon has 10 different stations where they have 10 different contractors, you technically have to inspect each station. If they're all under the employee and the employer saying, hey, these are our policies, this is how you're supposed to clean and everything, then it's one.
Does one inspection a year sound reasonable to everyone as a starting point?
And I think would you just make it 25 for every reinspection? Like if there's a violation, we have to come back. Is it?
Yeah. Yeah, and we're not trying to get too far in the weeds on the fees exactly, because, but this particular regulatory area is super sticky because there's so many independent contractors that are parts of facilities. So we've just
Hard to hold the owner accountable.
talking about how do we do that, because they all operate so differently and there's so much overlap between the services.
Yeah. Makes sense.
So I mean, ultimately, the main concern is that someone doesn't go get their nails done and they end up with some kind of nail infection.
Mhm.
And so we just want to make sure that they're cleaning their tools properly and all
They're
that.
doing all the right stuff. that we
Exactly.
expect them to do.
And the table sanitation for the massage parlors. I guess the tattoos are already under some kind of,
Tattoos have pretty strict, at least rules that are already laid out at the state level. So and any of these places, we have the ability to inspect if there's a problem or a complaint. This just establishes a more like formal process to make sure that we're getting in there routinely to monitor a little bit more closely.
From a philosophical perspective, for the longest time, the city of Fishers has basically banned tattoo parlors. Or you really can't get a tattoo at Fishers for all intents and purposes. But I think Monica's made the argument to me before, and I think it holds merit. If people want that, which a lot of people are getting tattoos, we should create an avenue for them to do that here with standards that we can make sure that can be done in a safe and effective manner. So I think there's an opportunity here to provide that.
And there have been workarounds to that rule just because the zoning doesn't rule out the spa services like the microblading and the permanent makeup. Those are all tattoos, right? So people that do microblading are now doing fine line tattoos because those are very similar, and they're not necessarily a tattoo parlor, but they're still offering tattoo. Infectious disease standpoint, right?
those are our recommendations,
Great.
$25 per inspection. And based on if there's individual
Do you need a
companies.
motion on that?
I
Or do
don't
you just
think
want us to bring it
Get a motion.
wanted to-
Can I get a motion for a $50 permit and
motion.
vote on that? Any room for debate on that? I think we debated it. And the vote's for yes? Aye. No? Okay, the ayes have it. All right, what else do we have?
Okay, the next one is just sort of awareness to you guys. Again, if you want to weigh in on this, we've been in talks about being able to expand our services to include mental health navigation in our clinical space. We're looking to have a focus on, particularly on families and youth, but not totally limited to families and youth. Potential to expand to the ability to consult with a therapist on site, potentially. So we've been in discussion with an area provider about possible contracting or other ways that we could go about meeting this need. I guess I'm from the board, just looking for any kind of weigh in that you wanted to make on anything in particular we would need to make sure to be cautious of in any of that contracting or questions that from your angle you would want us to make sure that we're asking before we get any further down this road.
I think that, we need to take a hard look at the Rely Center and 988. If those are resources that are underutilized. And before we decide to contract, provide behavioral health services, we make sure that we're using Rely and 988 to the best of their ability.
That is a deep part of the discussions that we're having. So we don't think that this would take away from that at all. We've gotten some good data from the Rely Center from Vanessa Pataki, who was here at the board meeting a couple of months ago to present on that. And I think this would augment that, not displace any of
I
that.
think in fact, one of the providers we're talking to provide the services would be the same people that are providing that. So what I'm interested here is, I'm not sure we're providing quote unquote mental health care so much as like a referral service that people
Navigation.
come in and figure out, okay, hey, I got a situation. I don't know what I'm supposed to do. Should I be going to the mental health hospital? Should I be going to the center up in Noblesville? Or does my kid just need and I think that's more where we want to live.
Guidance.
It would be a much bigger step for us to say, okay, we're gonna start providing quote unquote extensive treatment. I don't think we're prepared for that. Is that fair?
That's fair. And we got some really good data on Rely Center on who they've seen so far. I think they've had, I think they said maybe 170 people. Is that right, Jen? That have come through there so far since they opened, which is great. The vast majority of those sounded like they were med refills from all over the community, not just that one provider. So lots and lots of med refills. They've only had one hospitalization and only 5 overnight holds, like on the 23-hour station. So the vast majority of what they're doing there is med refills. Surprisingly,
One of the,
we're not going to be doing that.
one of the areas that I thought was intriguing I had a breakfast with childcare providers, early child care providers. And a lot of them were talking about the number of kids that are having behavioral issues and they're being basically thrown out of the daycare centers. And those childcare providers don't really have a resource to say, hey, why don't you, mom and dad, you should go talk to these folks. And I think what we're trying to provide is that person that they could go to that says, I'm sure you see this in your primary care work. It's like, we're just going to be a resource bank so that we can help them figure out what direction to go with that. That was one of our ideas with this, I think.
That would be very helpful to your local pediatricians.
That's what I imagine you're getting that all the time.
Because I spend a lot of time
I would imagine.
even the video visits regarding.
And they're just trying to figure out where to go for resources.
And they call in such distress
Yeah.
and just, they need an answer today. They're overwhelmed.
Yeah.
This is Aspire, right? So we're like, yeah.
Yeah.
So we do send a lot of kiddos to Aspire.
Yeah.
Is there anything, so something like this, would the schools or would the daycare be the partner up to help them?
Yes.
So that's the goal is we would
Right.
want to be reaching out to the pediatricians, to the daycare providers, to everyone, just to make them aware of the resource. And then whether it's Aspire or another community partner, in conjunction with that. So we've got a clear pathway for where these folks can go, but not limited to that pathway, right? Like somebody that can navigate through all the resources to find the most appropriate one. We're in constant communication with HSC schools and trying to, to make sure that people are on that pathway. I know just going from the preschool space to the school space can be hard to navigate when you get into 504s and then IEPs and all of that. So Molly Kerwin, the health person at the school, part of all of that. She's part of these discussions. How can we best support the school environment? And that's through supporting families, really, right? Like, in how did they even start this process?
I'm really glad to hear your perspective on this because I think where we've tried to position the health department is in the spaces that the healthcare system today, like it's not the highest and best use of your time as a physician to be navigating resource allocation outside of what you would be providing. And so it's good to hear that there's a need, and to that, we're not duplicating efforts, but rather we can be a resource.
That would be a
To
great
you.
resource.
And it's a lower barrier than having to walk into a place like Aspire, right? To say, come into the community center, just pop by and we're happy to answer a question, which is the goal, right? Like it's like a kind of a half step.
AAP, we were doing Be Happy for a while.
With the state
Yeah, with the
program,
state
yeah.
program. That was helpful, but in this area, as a local pediatrician in this area, I still feel like I didn't
I think one thing you guys should all be aware from a policy perspective is this service isn't something we can really bill insurance for. And so out of our budget, this would be a line item that we're really just using public health dollars to provide. Because you're the expert, but there really isn't an ability for us to recoup the cost of this service, but we think it's a big enough need that it gets put in that category of like, this is a public health matter that we need to provide.
Consistent with our mission.
Exactly.
This is, I'll just add in, navigation was one of the strongest indicators from community voice through the survey, through focus groups, just knowing how do I get started.
Didn't they just start 24/7 services?
I think so.
Yeah,
I think
last
they just said that they did, yeah.
Yeah, so that's a great resource, especially for kiddos. So.
Yeah, but again, we're not trying to be duplicating anything that anybody else is doing.
Steer
It's kind of saying, how do we get people to whatever the right place is?
Patient navigator, yeah.
Yeah, and have a friendly face that's easily accessible, so. Great, this is all great perspective, thank you.
Yeah.
I don't think we need to vote on anything unless you guys are inspired to vote.
Sal, do you want to vote again? I know you like that.
Last time.
The only thing, Monica, I would just bring up is, do you gather more community partners? Because you start navigating, what's gonna happen is they're not gonna be able to get you in. If you're in crisis, that's one thing, but if you're just trying to navigate and figure out, then they're gonna say in 6 months, we'll see you. But if you start pulling in community partners, that might be.
Well, I mean, that's part of this role is that navigator has those relationships, right? So that they can advocate for that person and it's a warm handoff. It's not just a handing of a resource. It's I'm going to get on the phone call with you and I'm going to help make that case for why we need to accelerate this for whatever reason.
It's a great question, and one of my concerns was if we contract with Aspire, is Aspire only gonna navigate into their system? And what I learned is that they're going to be agnostic. They're gonna look across any resource and say, we're gonna get you in wherever we can, which is helpful.
That's what should happen. It just,
It's a point of concern for sure.
yeah, because you have to wait and I think that can be an issue. So if everybody works together rather than one place that only goes to one place, you're gonna have better service for the families.
I agree, and we debated this because I was like, well, let's just hire someone independently. That's our employee that doesn't care. They don't carry any brand behind them, so to speak. But and I think we can still reserve that right to do that down the road. I think what this gets us is someone who's trained and ready to go. We can try it out, and then if it's not working, we can switch to our own employee, or if there's the body of work that's so significant, we can
You
bring
have
it.
to pull community resources because that will get people the help they need.
And you'll be
Well,
getting
we-
feedback, right?
Yeah,
You'll be
yeah.
getting feedback from the clients and you'll know if it's
So we
working.
can- The feedback loop and again, that strong connection with the schools, right? So they're very tuned in. Molly's got a running list of who's accepting patients, like, and where she can send people to. So this is all meant to be a collaborative, coordinated effort with all of these. We work with a lot of the independent providers as well, just to, who are saying, hey, we've got spots, like that constant knowledge of where we can go and where we can get people in. So that's the hope, that's the goal. Of course, it's complicated.
Right.
But you'll have oversight, so you'll know if there's hiccups and.
Yeah, so what we're looking at now is where do we start? What are the hours, that we start to trial this, and what are the data needs that we would have with any kind of contract? Like, what do we need to make sure that we're getting back on it from a knowledge standpoint so that we can make sure that we're providing a useful, valuable service and that we have kind of a pulse on what kinds of things are presenting so that we can adjust as necessary.
And you'll report outcomes to us, so we'll have all
I
that.
think the next step, and I'd be interested to get your thoughts on this and others, is how do we get the word out that the resource is there so that daycares and primary care pediatricians all have access to it? I think we're gonna want to work on that marketing plan. So,
I mean, I think locally, just within the networks you have around you,
yeah.
to get the word
Get
out.
the word out.
Maybe by the sound of it, we'll be concerned about being overwhelmed. Quite possible.
Probably, yeah. So, especially the.
The preschool age,
Yeah.
yeah. And that's who we're
5.
hearing from the loudest, I think.
Always from the daycare.
Yeah.
And the daycare providers feel terrible,
Yeah.
but at the same time, they have kids that they just can't put with other kids.
But I think the feedback will be helpful to us as we see what the frequency of different kinds of issues are. And then we can say, oh, okay, well, if it's this type of issue, maybe we need, a class to train people on how to better handle things, right?
That would
Like,
be amazing.
so that's the
Right,
goal,
something
right?
like that, Especially even just for the parents, the parenting.
well, I'm thinking most of it is gonna be in
Yeah.
that category.
That's what a lot of my time goes to.
Yeah.
Discussing those things.
Yeah.
But it's that age range that's hard because most places take only above the age of 5. So it's the 3 to 5 toddler group, right?
Moving on, okay.
That's me, yeah. So another service that we are thinking about adding or that we want to add this year is sports physicals. Really the timeframe that we would be focusing on is April 1st to June 1st, just based on the IHSAA requirements. So we were proposing a $25 self-pay for those. I listed out what some of the other places around here are charging for that. So obviously coming in kind of right there at the lower end of what folks around us are charging. We would offer these all of the time, but really we would do kind of a big blitz in that April to June timeframe so that that's when the forms are due. Do we need to vote on that or?
It's a recommendation for the sports physicals to be $25. And from what I understand, we don't want to separate Fishers from non-Fishers residents. We welcome whoever.
We would welcome whoever. I think it's predominantly going to be HSC schools folks and that covers a little bit of Noblesville. I don't think we're going to need some more other people. Marion County offers this as well in their adolescent clinic.
I just have one recommendation. Do you also tell them to make sure you?
Of course.
See your pediatrician?
Yes, of course. Yeah.
Okay.
I won't see my teenagers for 3 or 4 years because they went and got their physical at places like this. And then they come in 3 years later and all this stuff has happened. Because they got their sports physical somewhere else.
We're good to go.
They come in. And big things have happened. And so I feel like just making sure you remember.
We can take care of that. We basically recommend that this does not replace a annual physical at your pediatrician's office.
Let's just get you on the basketball court.
It's a great point, because even when we were looking at what price to propose, and Laura did a lot of research, and it's not a comprehensive exam. We can't charge a comprehensive exam fee for that. Yeah, because they do need to still go see their.
So my recommendation, physical exams, $25, but you have to have a note that you had a annual exam at your. Go. Maybe he has to take your.
I'll make a motion to approve the recommendation with $25 self-pay.
Second.
Second.
Okay. Ayes? Aye.
Aye.
Noes? Yep. All right. Ayes have it. Passed. Recommendation, $25. What else we got?
Okay, biometric testing. So this is something we want to launch in the middle of February to coincide with Heart Month. So this will be cholesterol screenings, glucose and A1Cs as well. And we are proposing $20 self-pay for that. The cartridge cost per person is about $17.63. So that's not including the purchase of the machine and whatnot, but felt like $20 was a fair price to pay for that. We are going to put in some like minimum amount of time that you need between having these tests, so we don't have people coming in weekly asking for a biometric screen when not much can change that quickly. So we're still working through all of those details, but wanted to propose the $20 self-pay fee.
What do you do with abnormal test results?
But definitely provide education and refer to primary care, community partner.
Do we have someone that, if they have no primary care, do we have someone that we?
Yeah, we have lots of different community partners we can refer to if they're uninsured or underinsured. Not, we won't send them to the ER unless it's a medical emergency, if that's where you're headed.
Cell phone.
To put you out of business.
Yeah.
I don't think you're in danger of being
I
out of
think-
business anytime soon, but.
Spend a day in the ER and you'll see how far we are.
We should get like a cutout of Sal. And then just a little business card, talk to Sal.
Yeah.
Cell phone on it.
Dr. Sal.
I love it. We need to vote on this too.
Yeah,
Oh, yeah, okay. We have a motion on this $20 biometric.
I'll second.
Votes? Aye.
Aye.
Votes? Yep, okay, ayes have it. $20 biometric recommendation.
Okay, and then I can talk about the last one. So currently for clinician visits, the current language in the ordinance states that we will charge at Medicare rate. We are requesting to change the language to read no more than Medicare rate. This will allow for more flexibility as we're expanding different service types, especially for doing service types that we can't bill insurance for. There's just more flexibility that,
Which the sports physicals fall in that.
yeah,
category.
fall in that, but as we look at more like lifestyle medicine type things that maybe we want to do, we won't be tied to the specific like evaluation and management rates, which can range anywhere from it's $51 all the way to $202. So it's just giving us some more flexibility.
Need a motion for that.
To go lower.
You just, if we
It's a
know
cap
more
at-
than.
it's a cap. And so that actually
Same.
benefits where the fee can be lower. Right?
Mhm.
That's a
Yeah, to
very
make it
important.
more,
Yeah.
to make it more
When you
affordable.
said
try to-
ordinance, does that have to go to council?
Yeah.
So that's just a recommendation.
All the fees have to go to council
Okay.
anyway.
Recommendation, good to go.
Recommendation, motion. It's passed.
Timothy, one thing to note, I would like to talk to you offline about, whether or not we can delegate more authority to the Board of Health from the council. Like if the council were to pass an ordinance that says, as long as the Board of Health lives within the confines of this, we don't need to bring all these things back to the city council. Just be curious to see what we could.
Yeah, I can look and see what those powers are. We'd probably also have to do like a written resolution so
Yeah.
that I could give it to Jenny to publish.
Because I think-
the envelope.
It'd be nice to kind of give this group autonomy to go do these things. Go back to the council.
Yeah.
Question. I know that we've got pharmaceutical disposal still in the lobby of the police station. Do we have needle disposal for?
We do have needle disposal now, so that's something we implemented maybe 2 months ago. So anybody can bring sharps to our clinic at the community center. Yeah.
Oh,
and we've
that's
been-
nice.
Yeah, it's really.
Yeah, we've been putting that on Facebook and stuff. I think we've been getting people coming in, since we put it out there, to dispose of their sharps. Yeah, I don't know what else. I'm supposed to say
Including
about that.
canine and feline patients.
We don't ask where the sharps are from.
They must come from humans.
Container, so it doesn't have to be a formal sharps container. It could be a laundry detergent
Okay.
bottle or something like that, but puncture proof container, please. We don't want to get poked
I
by.
just want to see you drop it off.
Trucks will probably have questions.
No,
directed
these are
to
diabetic
your
patients.
contractor.
Yeah.
So you want them to bring them in a container?
Oh,
You can't just throw it in your container.
no,
Things full of insulin needles.
But I think there are some communities that actually will, you can,
Hamilton
Nice.
County and Marion County does it at the recycle centers.
no, but you actually, they give you the container, you
Yes.
have it at home and then you bring that back.
yeah.
And they'll give you a new container.
Right.
Yes.
Currently providing the containers, we're accepting the containers. We could, I mean, we're just kind of trialing this and seeing how it goes with the drop offs. And so far it's gone pretty well. I
I've
mean,
been asked about it, so it's a
Yeah.
good service.
so we do have that. And then the other thing I was trying to think of that I wanted to address is to your point about the drug disposal. We have kind of a new system as well that we found, which is a company that has like envelopes that can be mailed in for destruction of medication. So we're using those especially with our fall prevention clients that are a bit over medicated. So it's a much actually cheaper way to dispose of medications that we're trialing right now. So
Excellent.
we'll
Anything
try to
else?
fly through the rest of this because we're already at time, I think.
Yeah. We got finance updates.
I just wanted to give the board a picture of 2025 year end, where we ended up. So the chart at the top is our revenue under the different categories. So you'll see for 2025, our budget was 160,000, or I'm sorry, 260,000 total, and we ended up with over 750,000 in revenue for our different service areas. If you look at 2024, we were at about 280, so we had a 62% increase, which is just wonderful. I mean, really with everything we've done to expand services and even the new and vital records opening up has helped in that. And then our new food permitting fee structure has helped as well. The bottom chart is our expense. So you'll look to the left, that's our operating account. Our budget was about 1.8 million. We've spent almost all of that. we spent 1.8. And then in HI with our rollover and the amount that was given to us for 2025, we have remaining a little over 500,000. So we spent about 74% of that budget. And it was kind of intentional to move whatever operating expenses we could to the operating side of the house. And so we could roll over those HFI funds and be able to use those to help sustain 2026 personnel and programs.
So this is a little bit of a double-edged sword, just legislatively. I know one of the concerns the legislature had with the Helpers Indiana was some of that money wasn't spent down, and that was one of the justifications for not continuing the funding at the same level. But because of the way that the money was taken out back in April when we were talking to you guys, this is really just going to get us through this year. So next year, all of this news will help us as we prepare ourselves for next year, but this just gets us to this year.
And the vaccines, we made a good amount of money, not because we are inflating the price of these
Because we
vaccines.
started billing,
We just started billing.
The bill.
billing. It's just billing, and she's got some great charts on the impact that has made.
So I don't want the community to think that we're making money off of their
Nope,
vaccines.
No. We're only, the vaccines is 110% of cost is what we're charging. So it's very minimal.
Yeah.
I mean,
It just, it's more volume.
and getting that administration fee for the vaccine.
Yeah. And I think a sports physical with vaccine at the same time,
That's a great.
we can knock out those pediatricians. We don't,
I think she's in danger of going out of business either.
This slide is talking about our 2026 budget. The operating budget, we have about 1.7 million, and this is the different categories. So personnel is a little over $1 million. In our program area for clinic, we budgeted about 490,000. And this is new this year. We didn't budget in program areas in the past. This is going to really allow each program area to kind of be in charge of their own budget. So you'll see each category, admin has 57,000, school outreach and health is at 26, vital records at 12, and mental health is at 22,000. Again, this is just talking about, you'll see the 2026 HFI budget, 527,000. Last year we had 1.9, so that was our huge decrease. But then we have this rollover of 515,000 from 2025 funds. And then this slide talks about our clinic revenue that we received for the year. So you can see the orange line is 2025, the blue line's 2024. You've seen the ebbs and flows. Our highest month in August, basically that was just due to all the back to school vaccines and appointments we saw in clinic, and then all of our pop-up clinics. And our second largest month was October. Again, that was more seasonal flu, getting reimbursed for all the seasonal vaccines. At year end, we ended up with an open AR of about $6,000. And our annual adjustment, so that's write-offs and denials for the whole year, was at 16%, which is really good for just doing this year. And then this slide represents, we're trying to recapture some of that expense. So our goal for 2025 was 50%. The actual year to date, we ended up at 59%. Our goal for 2026, we've made a goal of 65%. We think just we'll have some increased personnel costs with walk-in hours, so that maybe won't get us to like the higher 70% you see in like November, December that we had. So that's really just looking at the expense side, our staff time, the cost of vaccines, and then looking at the revenue that comes in against that. Grants and contracts. So, yeah.
I'm assuming it falls in the clinic. I'm just curious how the travel clinic did in terms of, we've got about 9 months of data now. How did that individually do?
I think we ended up with about 140 overall. It averaged about 17 a month towards the end of the year. We just launched with PR, kind of a bigger campaign around targeting local businesses and study abroad programs and things like that. So, yeah.
Any other questions? Sorry. Then contracts and grants. So we have applied or are applying for these grants. So there's the NEHA FDA Retail Flexible Funding Grant we've applied for and have received since 2022. So that application is open. Currently, it's due on February 12th. So we're applying for that. Would be $20,500, which allows for travel for our food inspectors to go to conferences and then also work on the 9 standards as it relates to retail food inspections.
And just to jump in on that, our inspectors are definitely making a name for themselves. Like Dan is getting interviewed today by the FDA for one of their newsletters to promote all of the work that they've done. It's really important. So.
This grant has helped fund. So, and then we're also through NEHA applying for the National Environmental Health Internship Program for the summer. So that's not, we don't get any money from that, but they pay for an intern to come and help us out through a few different projects that we've identified. And that is due on the 1st. And then we also applied for Alzheimer's Association grant to be part of a risk reduction learning community. And that will support travel for one of our health educators to travel to Atlanta for this learning collaboration and for her to kind of bring back some of that knowledge as related to Alzheimer's disease. And we already kind of work in that space, so this will just supplement what we're already doing. Projects that we have funded out of HFI last year was through with the Shepherd Center. So they provided some data related to that program for Q3 and Q4, the last part of last year. They had helped 117 residents through their resource program with over 1,000 touch points. Their counseling program had 161 therapy sessions for 33 residents. And then again, we still are receiving data from Project Hope, which is the mental health referral that we're supplementing and paying for in the school system. So they had 31 referrals this last half of the school year, when last year they saw 41 for the whole year. So we're definitely seeing an increased use, and there's 30 students actively receiving support with 23 new this school year. And then
we do expect that program to continue, even though the provider for school-based services is changing, the community health network pulling out of the mental health space, that we do expect this program to be able to carry forward.
And then we also still have our school health club grant. There's 7,200 remaining in that fund. I don't have any new grant applications from the last time. So if you know any teachers, get the word out there, where PR is working with us on promoting that more, so.
Okay. Okay, so there's our percent utilization of clinic space per month. So that's really looking at the open number of appointments that we have and how many of those were filled. So just as a recap, in 2025, we added travel, STI screening, pregnancy, LTBI provider visits, STI partner treatment, sharps disposal, titers, and received our 340 visits. So 2025, we were quite busy. So you can go to the next slide, Josh. So even though our percent capacity was up, our overall number of appointments were actually less than in 2024. And really some of that is due to having longer, more complex appointment types. So we weren't able to see as many people in the same amount of time. But another reason, you can go to the next slide, thank you, is really looking at some of these services that have drastically decreased from 24 to 25. So immunizations, you can see actually increased, but our QFTs and DOTs dramatically decreased. So when we have a DOT patient, that's counting as one patient every single day, essentially, as we're monitoring them taking their medication. So even though the overall number of patients are down, the services, the preventative services that we're providing have actually increased. You can see flu, routine immunizations, and return to clinic immunization. It's all increased.
There's nothing we can do about the DOT. I mean, that's just how many tuberculosis patients we have.
So looking forward to this year and how we're going to continue to expand. So we launched walk-in Wednesdays in the clinic the beginning of January. So we have walk-in hours on Wednesday for every single service except travel people can walk in for. We're working on PR promotion for that. We've seen anywhere from 4 to clients per walk-in Wednesday so far, which just for like word of mouth and a couple flyers is not too shabby. So we're going to continue to push that. Also in the middle of January, we expanded our Tuesday hours. So we actually opened an hour earlier. So adding more appointments that way. Monica mentioned the med disposal mailback program. We started that in the middle of June. Again, we'll be promoting that. We will be launching the biometric screens in February. That will be done in tandem with a Heart Health Know Your Numbers educational event. Then they can come into the clinic and get their biometric screening. And we will also have the IU Health mobile lung screening available that day as well. Sports physicals, rabies post-exposure is still on the radar. I don't have a date on that yet because we're kind of focusing on all those other things. So that's about clinical services. For programming expansion, we'll be launching in May some maternal child health programming. One of our public health nurses is achieving her lactation consultant certification. And we'll be working in tandem with some other community partners to provide some programming there. We'll also can open that up for lactation appointments that people could make in clinic, and then launching a full kind of chronic disease prevention program for 2026.
Has it started, the lactation?
Not yet, no, but soon.
So what's
Well,
what's the rabies post-exposure?
What you do in the ER.
Yeah, like what are you gonna do?
What you do in the ER. We won't do the initial infusion, but we could do the follow-up.
If I see someone in the ER that needs they get their first,
Yeah.
Then we can come back.
You can send for 2 and 3.
let's say, go to the health department and they'll take over.
Yep.
Wow.
Yeah.
Trying to make your life easier.
We're not coming after right now.
We're gonna get you. You guys sell drugs at the,
Actually sends the TV med, so.
And then this is just in some of our other programming areas. For health education in 2025, we touched over 25,000 community members, educated both in the schools and in the community. This year for health education, we're really focusing on aging well and tying a clinical action or clinical service to that. I mentioned the biometric screenings. They're also in Heart Month having a like healthy habits class, and then they'll take all of the seniors up to the track at the community center, help them download the app and figure out how to scan and all those types of things and do some walking after that. So really trying to figure out how we can tie service or action to our education. Our social work team supported more than 1,200 residents in 2025. You can see the number for emergency detentions and in-home visits. As we mentioned, this will be a big area of focus for us in 2026. And also really trying to figure out how to incorporate mental health screening tools and clinic and outreach events. And also completing a pretty robust assessment on what type of community supports groups we have in Fishers. And then a goal for all of our programs is to increase our persons served 10% in every area. So that is what we're looking at for 2026.
Just a small, tiny.
Oh, and I put the picture of us moving on there because we did all of that and we moved into a new space last year too. So it was a big year.
I had a breakfast with our favorite software engineer this morning,
Uh-huh.
and he,
Yeah, I've been chatting with him.
pro bono, he wants to help with the app.
Yeah.
Cause he's,
Yeah, I connected him with Rome and BSG because we don't have anything to do with the app.
okay, I'll make sure he reaches out.
And I think she's reached out to him. so.
Okay, good.
Fisher's Health Department app.
It's not our app, it's the community center app. Like, so if you've been to the community center, you can download it's a free app, like, and that will get you into the walking track, or you can make an appointment for your kid on the play structure. So the app is needed to access both of those free community things, or if you buy a membership, then it also is, how you scan into the membership spaces.
Okay, I'll try to talk quickly through our strategy. So just to give you an update on where we are, completed some of the final draft of the community health assessments, and we'll work on getting that visualized and online. Incorporated the community survey, analyzing that both qualitatively, quantitatively in our focus groups. And what really came out of that was the health indicators and the community voice is pointing in 3 particular areas: mental health across the lifespan, healthy living, aging well, and that already organizes a lot of our work that shows opportunities for expanding programming and services. Mental health across the lifespan, focus on youth mental well-being, substance use prevention, community connection. adult screening access, mental health navigation. And then there are sub areas under healthy living and aging well. For the interest of time, I won't necessarily read through all of those. But to give you an idea of like mental health across the lifespan, encompassing work on youth and young adults, that's where a lot of concern and need was expressed from residents, a lot of indicators around there. Just to show you like one health indicator data point is just seeing this preponderance or the proportion of self-harm, suicide, ideation and intent or attempt. It's concentrated in our younger populations. That's what the graph on the left is. And so we have youth and young adults education series that will help build out these services that we're talking about with navigation, focus in that area a lot as well. Healthy living, this is will address nutrition, physical activity, lifestyle related conditions or opportunities, increase access or fringe services. And just to show you, a lot of that will organize around conditions we have. And I put a graph up here showing those for us: obesity, high blood pressure, high cholesterol. Depression is one area where we actually statistically exceed the county in the US on adults age-adjusted prevalence rates. Our modeled estimates from national resources show that it's lower, but then when I modeled and weighted our survey data, it's actually higher. Aging well, we just have a growing, very, very fast growing older population moving into the community, aging within the community. 65 and older has grown almost 200% in just a decade. It's continuing to grow. It's almost 14,000 people, you know, it's going up there. And so we've talked a lot about the success of our fall prevention program, and it's our one easy area to target, highly preventable morbidity and mortality amongst our older residents. And we'll have a lot of additional programming. Social connection was a strong desire from these residents and more opportunities to be connected, but also particularly caregiver support services for individuals caring for our aging population. On our next step in strategy is connecting the pillars and making sure that we address like cross-cutting threads. Social connection and belonging was a high expressed desire, and there's a large burden here and everywhere. But in Fishers, for example, it's almost 1 in 3 adults experience some form of social isolation. Navigating and knowing where to start. Part of this is the behavioral health navigation we're talking about starting off, but going beyond that too is looking at social emotional well-being, and then just prevention, early identification opportunities. We're rolling through our community health improvement plan, ensuring that we get community voice into where our strategy programming areas should really put additional effort into, and then rolling that out with some stakeholders, bringing it back to the board on some measurable opportunities to improve in some of these areas. Jen and I have worked really hard for the last couple of months to start writing out our strategic plan for the next year. I'm kind of excited to share it with you guys just so other people can see sort of the preponderance. You won't be able to read any of this, but this will be a dynamic living workspace where we can look across our 5 pillars of work. Those 3 strategic pillars are core services, and then our sustainability and community engagement to always shape our work and expand it. And we wrote out, I've lost count at this point, but we literally have at least over 40 key performance outcomes that are definable, measurable, and that we'll keep an eye on in the 2 to 5 year time horizon, with KPIs rolled underneath those that have a little over about 150 KPIs right now across all of our work. And this is just organizing the work that we're currently doing with a few additional expansions. And so we have this workspace that all of our team members will be able to go to. We'll be able to track how we're performing, where things are on track, off track, and how we can adjust, and then also how we can improve it, and then readjust our work on a more frequent and constant basis. So, yeah.
And certainly, I just want to extend an invitation to all of you as board members. I know you guys are all really busy, but if anybody really wants to dive into this or really look at it and give information, we have a draft of the community health assessment. I know that we've been talking about that. We're in the review of the draft phase. So if you're interested in reviewing that draft, that absolutely is an option for you. If you don't want to, that's also an option. But certainly we would welcome any of your input and feedback. Those graphs are an example of the types of information that are in there, and they're very specific to Fishers. The same with the community health improvement plan and the exercise and activity that we're doing. We have worked at the community center, we're doing it online, getting folks feedback and like, okay, these are the pillars, but what actions do you feel as a community that we need to focus on? So if you want to have a look at that, we can send you that link. Certainly if you want to look at our strategic plan workspace and wade through that, and the hundreds of indicators, you're welcome to have a broader peek at that than what you can see here on the screen, which is a bit overwhelming. So just let me know.
Anything else?
Just a quick update on FAB accreditation. The last time we talked about kicking off like our gap analysis by domain and making sure we stay on track to submit for our readiness assessment in Q4 of this year. And so we did that gap analysis. We have projects identified across nearly all the 325 documentation types we'll have to show for conformance, with a gap of roughly 10% where we would need to organize our work a little bit better. And that's the phase for this quarter and next quarter, is to get documentation ready and shortened so that Q3, we go through our own internal intensive assessment before we submit and get evaluated on how ready we are for accreditation by FAB in Q4.
Questions, concerns? Sorry, we went over time.
Overtime. Any other finished business, no new business? I want to just say a couple of things. For those of us have been here since the beginning, isn't it wonderful how we've progressed from where we were to where we are now? I mean, we are trying to help the community by not being a centerpiece. I have a challenge because we always talk about the January and new stuff. Sort of like the the Aspire directs traffic. If there is a way that maybe we can get students to volunteer, contact us. I'm interested in vet, I'm interested in pharmacy, I'm interested in clinic, and maybe connect them with some kind of a volunteer work where they can volunteer. It just would be a nice thing just to reach out to the community, because there's a lot of kids out there that might want to do a ride along with an EMS. I'm not sure what the logistics or whatever, but just get an idea, just like get them into this public health and all that stuff.
You know, I think it's a great suggestion. I can see a lot of ways that we could tie into stuff that the city is already doing and the school system is already doing. Actually, like we've been talking with the school system about this career network path. Jen and I have both been in meetings with HSC schools folks and community partners on how to build that network out, and then just ideas maybe for our volunteer coordinator and how we can expand volunteer options that are already in there, because the goal of the city's volunteer network is to match some of those things, but I don't think we've thought about it from a career path perspective quite exactly. So that might be something to explore.
Just planting a seed. If there's nothing else, we adjourn this meeting at 12:23 PM. Motion seconds. Aye. Okay, well done.
Patience. We have a lot to say. We're not going to talk to you very much.